The health and well-being of community members is directly influenced by the systems that serve them. Systems include healthcare, public health, and human and social systems, such as those that provide education, transportation, and justice. But these systems often operate independently from each other and from the communities they serve, with each system's policies solely reflecting their own bodies of knowledge and producing fragmentation of the services they provide. A lack of alignment across how systems work hampers their abilities to promote health and well-being in communities. Without alignment, systems can find it challenging to understand community interests and priorities or share values and build trust in the very communities they serve. To address this, systems need to work together and with communities to align priorities, actions, and decision-making. One way to do this is with shared measurement. What is this project about? The American Institutes for Research, with funding from the Robert Wood Johnson Foundation, is exploring how shared measurement can be used as a tool to align systems with communities. Our goal is to develop and share a core set of principles with practical guidance for systems and communities on using shared measurement. Why principles? Principles are fundamental values that shape and govern system policies and objectives. A set of guiding principles for shared measurement can be important in helping organizations and people foster collaborative relationships, recognize what is desirable or undesirable among partners, change how they use measurement to advance equity, and ensure the intention behind measurement and alignment is equitable health for all. By doing so, these principles can enable systems and communities to use shared measurement in aligning decisions, policies, and practices towards equitable health. We define shared measurement as using a common set of measurement goals that reflect shared priorities across systems and communities. Why do we believe this work is important? Shared measurement enables systems and communities to work better together to define collective goals, monitor progress, and create accountability. Measurement is one of the ways systems define what success looks like. It drives action. This means that measurement has the power to create change in systems' policies, practices, and norms. These in turn affect the health of community members. One example that illustrates this is the All Children Thrive initiative in Cincinnati, a city where more than 40% of children live in poverty and have poor health outcomes. Under the initiative, partners from across public health, education, healthcare, and community-based organizations came together with a shared vision to make Cincinnati's children the healthiest in the nation using strong community partnerships. Community members are key partners involved in co-designing programs and co-leading teams. They participate in implementing, monitoring, and tracking measures. Together, they selected a small set of practical, actionable measures to work towards, such as improving infant mortality, improving the reading proficiency. They also created a composite Thrive at 5 measure to show if children are physically, mentally, and emotionally thriving. Through the principles developed from this project, we seek to transform measurement from a tool that reinforces the status quo to one that shifts power towards communities. What did we do? To explore shared measurement, our team reviewed more than 40 ongoing cross-system alignment initiatives. We took a deep dive into 6 of those initiatives through use cases to explore how systems use measurement in supporting alignment efforts across different communities. We listened to members of 6 communities from across the country to hear what matters most to them. We also conducted a survey of community-based organizations to understand how they work with partners to serve their communities. Finally, we convened a panel of 18 experts representing system leaders and community champions through a modified Delphi process of discussion and deliberation. What have we learned? Over 6 weeks of active listening and co-creation, the Delphi panel helped us synthesize all of the learnings from project activities into a set of 5 guiding principles that are practical, inclusive, and grounded in real-world experience. These principles describe how measurement that aligns systems with communities towards equitable outcomes requires upfront investment in communities to develop and sustain community partner capacity. It is co-created by communities to center their values, needs, priorities, and actions. It creates accountability to communities for addressing root causes of inequities and repairing harm. It focuses on a holistic and comprehensive view of communities that highlights assets and historical context. And it reflects shared values and intentional long-term efforts to build and sustain trust. To put these principles into practice, we are developing resources to enable community members, service providers, system leaders, and policymakers to more effectively align and collectively improve the health and well-being of their communities. To learn more about aligning systems with communities to advance equity through shared measurement, please visit the project website at www.air.org/shared measurement.